if you haven't met me yet, I'm a senior scientist at Eli Lilly in the Research Triangle, where we're developing a new site. And I've been in Nsp for about 8 years now. Started at NC State and have continued on into the professional chapter. And so it's my pleasure to be able to be here tonight and to have this panel of public health professionals to come and talk to us tonight about issues that are very prevalent in today's current time period. And so I'm going to begin our meeting by just going through the mission, which is how we like to start off the majority of all of Nsp events. And so let me just share my screen. Let me know when you can see. And because we're virtual, we're just going to go ahead and you can say it on mute because of the echo, but we like to start our events with the Nsp Mission. The Nsp Mission is to increase the number of culturally responsible Black engineers who excel academically, succeed professionally, and positively impact the community. And we also like to include the Nsp Professionals value proposition, which is the kind of meaning and purpose behind the Nsp Professionals. The Nsp Professionals inspire the next generation of technical professionals and serve as a catalyst for transforming the culture of engineering. And so that's really part of what Nsp is all about, is fueling the pipeline from our pre-college students to our collegiate students, and then on to the professionals, refueling that pipeline and making sure that we're continuing to produce technical STEM professionals in our society. So with that being said, I will hand it over to our esteemed Kirsten Ingram, who is our public health chair, which is a subset, I guess you could say. It's really its own division starting now, but we created this a year ago or a few years ago, and Kirsten has been leading in that area. And October is a lot of different months to bring awareness to different things that affect our society. But within Nsp, it's known as Technical Outreach Community Help Month. And that's a division of Nsp similar to our college initiative and our pre-college initiative. And it's where you're supposed to offer either technical or some type of service to the community and programs to the community. And so Kirsten and Ayana did a great job organizing this program. And so I'll go ahead and turn it over to you, Kirsten.
Thank you, Elliot. And thank you everyone for joining us today. As you know, we have been dealing with the COVID-19 pandemic for quite some time. We've gone from, in the beginning, no one knew what to do. Now we have amazing tools. The research and the science has advanced significantly since the pandemic first really impacted our lives back in March of 2019, so that we can move forward in an effective manner. And tonight we have the amazing opportunity to have 4 outstanding providers and public health experts to come and share their expertise with us in regards to the pandemic. The title for tonight's program is The Misinformation of COVID-19, Dispelling the Myths. And so without further ado, we're going to go ahead and get started with our first panelist. Our very first presenter that we have is Dr. Marian Johnson Thompson. She is a professor emerita from the University of the District of Columbia, as well as an adjunct professor at the School of Public Health at UNC Chapel Hill. Are you able to share your screen?
Okay. Oops. Okay, thank you so much, Kirsten. I want to say that it's good to be back with Nsp and some of my colleagues for the third time since the beginning of the pandemic. And I want to especially thank Nsp for their efforts in conducting these information sessions. And thank you again for inviting me. So I don't know why this keeps popping up, but okay. So I was asked to speak on the Delta variant, and that's what I'm going to do. But I'll just tell you that I will, so this is what I will address. I will address the origin and the rise of the Delta variant, the molecular properties and mechanisms of action, its role in the resurgence, the importance of vaccination to include the booster, and then just briefly, what is next? Will we have another pandemic resurge, or would this be an endemic infection? So just to set the stage, I wanted to show this graph. I'm sure that many of you are familiar with it. Here in February 20th, when we started with the virus, we saw this upswing, and then we kind of thought we were going down, right? But all of a sudden, the number of infections increased significantly, and then they decreased. And we really thought around February that we were plateauing. And of course, we thought that by June of this year that we would be doing very well, but we didn't. We had a resurgence. And then if we look at the number of deaths, we can see the same pattern. And in fact, by September of 21, 1 in 500 US people had passed. And so when we look at that surge, we asked what caused this surge. And a lot of it, we were saying it was because people had stopped using the safeguards and people wanted to get back to normal. But we also noticed that there was this new variant that was coined the Delta variant. And we know that many, many mutations occur all the time, even in our cells. And thousands actually of mutants have risen with COVID virus, with the COVID virus. However, many of them really had no effect, and this is very typical of mutations. But before I say more about mutations, I want to just briefly talk about the virus again so that we can see exactly where this Delta variant plays a role. So this is a schematic diagram. I'm sure you're all familiar with this diagram of COVID. And though it's a schematic diagram, it basically looks the same way when you look under an electron microscope. And in order to view this variant, you have to use an electron microscope. In terms of size, I can tell you that it is at least 3,000 times smaller than a human hair. So if you do a cross-section of this virus, you can actually see its makeup. And it's made up of this RNA molecule surrounded by a protein lipid coat. And on the outside of the protein coat, you see the spikes. And we're all familiar with these spikes. The spikes are the structures that attach the virion to the cell. Now, what we have seen, mutations can occur anywhere within the RNA, but these mutations tend to impact the RNA and thus causing a difference in the protein that's translated. And of course, the protein makes up the virion coat. So these variants, exactly what they do, they can do a number of things, as I mentioned, but the Delta variant causes the mutation causes a change in the spike protein. This is the spike protein coming out of the virus, and this is the cell, okay? So this model shows exactly where there's a change within changes within the amino acids that make up the protein. And here you can see in this variant, Delta variant, which is coined B1617, there are 1, 2, 3, 4 amino acid changes. And what happens is that it is so unlike the original COVID spike that it can elude the antibody that was specifically made towards the original virus. Therefore, it enters the cell. Now, a little bit more about the variants. There are 4 groups of classifications that identify the variants. Remember, I said that thousands of mutations have already occurred, but the 2 classifications of interest are, and it's called the variant of concern, VOC, and then the variants being monitored, VBM. The variant of concern, as you know, is the Delta variant. Now, there are a number of other variants, Alpha also being one that was pretty prolific initially, but it sort of died out and Delta continued to be the predominant variant. So the next slide will actually show you how this Delta variant emerged. At the beginning, you can see that 1, 2, 3, 4 different variants. This blue is the Alpha variant. And as time went on from May 21st to now, the predominant variant became the Delta variant. Now, this had a lot of significance because what we saw was that the Delta variant was 2 times as infective as the original COVID strain. And this allowed for this upsurge. And it's interesting that the upsurge occurred just as the vaccinations were produced and the person 65 and older were successfully getting vaccinated. The issue I think that we need to really look at and understand is the importance of vaccinations. Because what has happened in some of the pullback from receiving the vaccine has been that I've already had the COVID, so I'm already protected. And we know that this is not the case because those who've had COVID, they had it, many of them had it from the original strain, and therefore the immunity may not be effective on this new Delta strain. The other issue is in terms of natural immunity, even though natural immunity is is good immunity, it turns out that the strength of the immune response really depends upon the age and the severity of the infection. And as we know, many individuals were asymptomatic and others had mild infections. And this suggests that the antibody response would not be as strong. And so there's a lot of variability in the immune response against the virus through natural infection. However, we know that with vaccinations, they are constant. The antibody production is more constant in all individuals. Besides the vaccinations, and we've seen this through various studies, if you're vaccinated and you do get infected, your infectious process tends to be small. And so there are a lot of other issues that are associated with the importance of taking the vaccine, because if you take the vaccine, the idea is you prevent replication of the virus. The more the virus replicates, the more it can mutate to different strains that may or may not be, that the antibodies, whether natural or acquired, may be effective against. But I do want to show a couple of other slides that I think are important, just to show you the percent of the population that is vaccinated. And you can see here from fully vaccinated, at least one dose, and the booster, which we expect to be very small because it's just become available. But you can see that in the US, we're at 56.6. Public health experts say that we should be somewhere around 70 to 75. And so we're having a problem here because even though it's increasing more slowly. And once again, the more this virus replicates in individuals, the more you can get the emergence of these variants. And then just to show you what's happening here in North Carolina, if we look at fully vaccinated individuals, we're at 65%, and at least one dose is 70%. So we're getting there. And then the last slide I believe I want to show you is another argument that individuals use to say that, you know, when you say people are dying from COVID, the response is, well, people are dying anyway. Well, this slide shows the average daily deaths in the United States by cause. We know that in a given year, heart disease is the #1 killer, followed by cancer. But you can see how COVID has surpassed that at this time. And also, the last thing that we know too is that as a result of COVID, the lifespan has decreased. So for those who want to negate the effectiveness of vaccination, these are some issues that need to be looked at very clearly. Thank you very much.
Thank you so much, Dr. Marianne Johnson-Thompson, for that insightful and educational overview in regards to the Delta variant, how it relates to the booster vaccination, why it's important for us to get vaccinated, as well as, again, dispelling that myth in regards to how much of an impact this pandemic has had on our overarching lifespan. Thank you so much. Our next presenter is a presenter I'm so excited to hear him speak. It is Victor Armstrong. He is the Chief Health Equity Officer with the North Carolina Department of Public Health.
Thank you so much. Let me see if I can share my screen here. All right. So one of the things I wanted to talk to you about primarily is to share some information with you. And by the way, first of all, let me say thank you for having me here. It's a pleasure for me to be here with you. I think it's phenomenal that you all are having this conversation because there is so much misinformation about the pandemic. And as we just heard, it is costing us a lot of lives. And so something we all need to take very seriously. One of the things that we have been doing at the department is what we call COVID 101. And it basically is sharing some basic information about the pandemic, including information on how to get vaccinated and addressing some of the misconceptions around the pandemic. This is kind of a condensed version. I didn't include all of the slides, but I did want to give you just a little bit of share a little bit of information with you from our COVID 101 from the Department of Health and Human Services. So one of the things to look at is when we look at how the pandemic is impacting North Carolina, we've had nearly 1.3 million cases here in North Carolina and over 15,000 deaths, as you just heard from the prior presentation. And millions of North Carolinians have taken a shot, but we still need more people to get vaccinated. And you've heard the reasons why. And one of the things too is that hospitals are almost full and COVID-19 is still spreading. I came into this role working with the Department of Health and Human Services, having previously worked for Atrium Health in the Charlotte area. And working in a hospital, I understand how difficult it is when hospitals don't have the resources, don't have the space to be able to really treat people that come in on an emergent basis. And part of what hospitals have been struggling with over the past several months is having so many patients in their emergency departments as a result of COVID that it really has squeezed them in other areas. Prior to coming into this role as Chief Health Equity Officer, I worked for the department for the past year and a half as Director of the Division of Mental Health. And we were constantly having conversations with the hospitals about really trying to find other resources for mental health patients, because the hospitals were saying because they were so overrun with COVID patients, they just could not handle behavioral health patients coming into their emergency department seeking behavioral health services. So it impacts us in so many ways. So just a little bit of the facts about COVID. COVID-19 is most often spread in the air by coughing or sneezing, through a close personal contact, or through touching your nose, mouth, and eyes. And we've all heard this now for the past several months. Symptoms may appear 2 to 14 days after being exposed, and viruses are always changing, and new variants or strains of the virus are expected. And of course, as we've heard, the Delta variant is the most common strain of the virus now. Nearly all new COVID-19 cases are in people who are not vaccinated. People who have gotten their COVID-19 vaccine have a higher chance of getting people who have not gotten their COVID-19 vaccine have a much higher chance of getting the more dangerous Delta variant. And areas that have fewer vaccinated people are seeing more COVID-19 cases. So the more people that we can get vaccinated, the less cases we will see. That lessens the impact on the hospital. It also decreases the chances of you making other people sick. And if you have a mild case of COVID-19, you may struggle with long-term effects like shortness of breath, chest pain, brain fog. So we want to encourage people to get vaccinated so you can avoid getting the virus. A little bit more about the vaccines. Of course, the available vaccines in the United States are the Pfizer vaccine, which is available for ages 12 and up, Moderna available for ages 18 and up, and then Johnson & Johnson available for ages 18 and up. And the vaccines are tested, safe, and effective, and the FDA continues to monitor vaccine safety. And I know we have all heard people who say they don't trust that the vaccines are safe. And I always say to people, these vaccines have been vetted. They've been vetted like other vaccines and medications that we take, and we take over-the-counter medications all the time, not knowing the science behind them and not knowing the ingredients, but we take them because we trust that they are safe. Hundreds of millions of Americans have gotten their vaccine. They are safe and effective, and even against the dangerous Delta variant. And all available vaccines work extremely well at lowering chances of being hospitalized or dying from COVID with no real serious safety concerns. So regardless which vaccine you take, they are all effective and all of them work extremely well. In terms of additional doses or booster doses, the additional doses are available for individuals with immunocompromised systems, and they come through via Pfizer and Moderna only. They are available for individuals who have immunocompromised systems. We do encourage you to talk with your medical provider, your doctor, your nurse, or pharmacist for advice on whether or not you should get an additional dose. The booster doses, which are should be given at least 6 months after you're fully vaccinated. We know that right now it's only available in the Pfizer brand, and it right now is only available for certain people 65 or older, residents in long-term care facilities, people 18 or older with underlying medical conditions, and people who work in high-risk settings like healthcare workers, teachers, child care providers, or food workers. You may get temporary reactions after you take your vaccine. You could have a temporary reaction like a sore arm, fever, headache, or feeling tired. When I got my vaccine, I had a little soreness in the spot where I got the vaccine. Those were the only symptoms I've had. My brother and sister-in-law, they had some fever and achiness for about a day. So it does vary and impacts different people differently, but those reactions are temporary, and it's really a good sign that the vaccine is actually working, and it should go away within no more than a few days. And serious side effects from the vaccine are extremely rare and usually are temporary and are treatable. You may have heard about monoclonal antibodies, and I know for a lot of people, you know, it's a big word and doesn't really resonate with us as to what it means, but what they are is that while vaccines offer the best protection from COVID-19, treatment options are available. So monoclonal antibodies fight the virus that causes COVID-19. And if taken early, they can help you have milder symptoms. So what we are encouraging people to do is, if you do, you know, people who may take the home test, if you test positive for the virus, you can speak with your medical provider about monoclonal antibodies, which when taken can help to lessen your symptoms and can shorten the time that you are actually experiencing the effects of the virus. I want to touch base very quickly on some of the frequently asked questions that we get around the pandemic. One is, are children and teens able to get vaccinated? Any teenager 12 and up can get vaccinated now with the Pfizer vaccine. The Pfizer vaccine is fully approved for people 16 or older, and it's called, I always mess this word up, Comirnaty. The Pfizer vaccine is available under emergency use authorization for teens 12 to 15. Clinical trials are with thousands of people, including teenagers, have proven that vaccines are safe and effective, and more than 170 million Americans have been safely vaccinated against COVID-19. And more than half of the 12 to 17-year-olds in the United States have gotten at least one dose of a COVID-19 vaccine. Kids 12 and under cannot get vaccinated against COVID-19 right now, but Pfizer is likely to submit data about their clinical trials for children 5 to 11 and under 5 years old later this year. So we think that we're close to seeing a vaccine, at least for the children that are in the 5 to 11 age range. What are post-vaccination cases or breakthroughs? We hear about people who say, well, I got the vaccine, but I still got the virus. So even when a vaccine is highly effective, like the COVID-19 vaccines are, a small number of people who are fully vaccinated will still get COVID-19 if they're exposed to the virus. It's the same as people get the flu shot. It's not a guarantee that you won't get the flu. It lessens your chances of getting the flu, and it lessens the impact of the flu if you get it, but it's not a 100% guarantee that you won't get the flu. But post-vaccination cases are expected, because even when a vaccine works really well, like the COVID-19 vaccine, a small number of vaccinated people will still get COVID-19 if they are exposed, but it does not mean that the vaccinations are not working. And if you see that last bullet, in fact, that you are 1,500% more likely to die of COVID-19 if you are unvaccinated. Can I get the vaccine if I'm pregnant or breastfeeding? Yes, COVID-19 vaccination is recommended for all people 12 years old or older, including people who are pregnant, breastfeeding, trying pregnant or might become pregnant in the future. Pregnant women with COVID-19 have a higher risk of being hospitalized and needing care in the intensive care unit, and may have a higher risk of problems for the baby. So we encourage pregnant women to get the vaccine. Women who are breastfeeding can also receive any of the available vaccines. The vaccine is not thought to be a risk to a baby of a woman who is breastfeeding. Should I be concerned about the impact of the vaccine on my fertility? No, if you are planning to become pregnant, you can receive the COVID-19 vaccine. The CDC and the American College of Obstetricians and Gynecologists recommends vaccination for all eligible people, including those who may want to get pregnant. Women in clinical trials successfully became pregnant following vaccination, and there have been no safety data to suggest that vaccines impact the ability of a woman to get pregnant. And similarly, the Society for Male Reproduction and Urology recommends that men who want to be fathers should be encouraged to get vaccinated. Recent studies have also shown that COVID-19 increases the risk of developing erectile dysfunction by nearly 6 times. So again, we encourage men to get the vaccine. How do I access my vaccine records or proof of COVID-19? We know that more and more places are asking for proof of the vaccine. You can access your COVID-19 vaccination information in the North Carolina COVID-19 vaccine portal. This includes anyone who received their vaccine from a North Carolina provider and provided an email address to their vaccine provider. If you received your vaccine from a pharmacy participating in the federal retail pharmacy program, such as CVS, Walgreens, or Walmart, or from another federal vaccine provider, such as the U.S. Department of Defense, you'll need to get your vaccine information directly from that provider. It is not available in the North Carolina COVID-19 vaccine portal. So don't forget to provide your email address when you get your COVID-19 vaccine so that they can send that information to you. Do people who have had COVID-19 still need to be vaccinated? Yes, you should get vaccinated if you already had COVID-19. The vaccine works to protect you against a future infection. It is safe to get any of the authorized vaccines if you have already had COVID-19. If you were treated for COVID-19 symptoms with monoclonal antibodies or convalescent plasma, you should wait 90 days before getting a COVID-19 vaccine. And not sure if you got those, then check with the doctors who treated you. And a recent study showed that among people infected with COVID-19, those that were unvaccinated were more likely to get COVID-19 again than those who were fully vaccinated. So if you've had COVID-19, we still encourage you to get the vaccine. It lessens your chances of getting COVID-19 again. And if you have COVID-19 now, wait until you're feeling better and can't spread it, then go get your vaccine. Oh, sorry, that was my last slide. Thank you so much. Let me stop sharing.
That was outstanding. Thank you. I especially loved how you went through and said all the different myths and ways to address that and what the concern may be. That right there, because I've heard that time and time again, and everyone that is on the line and those of you that are joining us through Facebook Live, please feel free to raise your hand or to hit the like button if in fact you have heard some of those different myths as you've been out and about in the community, whether you were out with family, friends, or just out at a church outing or things of that nature. So those are all very valid concerns that have been discussion points all across the community. So thank you so much for bringing those up. Next up, we have, I'm almost speechless as I introduce our next presenter because she is our heavy hitter. She always brings the knowledge. She definitely drops the knowledge in regards to, especially all things related to COVID-19 and does it in such a relatable way so that we know how that we can take care of ourselves as we're out and about in our workplace, as our children were out and about at schools and in public settings. And so without further ado, it is my honor and pleasure to introduce Mrs. Sharon Baird. She is with the National Institutes of Environmental Health Sciences, and she serves as an industrial hygienist and program administrator.
Good evening, everyone. Can you hear me?
Yes.
Great, thank you. I just wanted to say thank you for allowing me to share information about the resources that we have available at the National Institute of Environmental Health Sciences through our worker training program. I am the director of that program and wanted to share some information with you that I think is absolutely applicable to your everyday lives in the time of COVID. One of the things that I want to share is that the worker training program has been involved in all different types of incidents related to worker health and safety training, but we are a national resource in climate change, related events, environmental justice, and health emergencies. We've responded to all different types of events: wildfires, mudslides, flooding and hurricanes, all different types of disasters that we are involved with, including Ebola, and now, of course, infectious diseases dealing with COVID-19. And we've been conducting training on all of these activities for quite a long time. So we've got a great knowledge and background of what's available to the public in reference to keeping them safe. We focus on the worker to make sure that they have an activity and have resources and tools to be able to engage and understand how to protect themselves and their families. We actually received $10 million in 2020 to develop and implement a national health and safety training response group. And we've trained over 70,000 workers since we received these funds. We've provided $6.6 million in supplemental funding to 36 of our grantees. We've created and curated hundreds of different types of curricula that's used for frontline and essential workers. And we've also developed a ton of different educational resources and webinars, fact sheets, and briefs that I want to share with you right now about to use to help you in your workplace and in your home. Here are some of the tools that I want to share with you. And I just picked a couple of these because these are the ones that I think are important to share right now. One of our biggest tools that we've developed is the building programs to protect workers from COVID-19 in the workplace. So what we've developed is a toolkit that can be adapted to any workplace environment, because we talk about what's involved in an occupational control plan, an exposure plan, what you need to know in reference to how to protect yourself in the workplace. So the first one up top is the general awareness. The second one is focused on the actual building of program. And the materials on the side here, on the right-hand side, focus on a control COVID-19 control exposure plan, which is absolutely essential to make sure that you actually are looking at all the components of a workplace or community-based organization or a school to make sure that you're controlling for the exposure. And then, of course, we have particular information about prevention of different types of exposures and infections that's related to COVID-19. I've also made a screenshot here of the different tools that we've got available. As you can see, they're numerous. We've made them available and translated them into multiple languages, Spanish, mostly for all of them, but we do have some of our toolkits in Vietnamese and Chinese based on the target populations that our grantees have for training. We've also made some funding dealing around our COVID recovery centers, and where they have additional resources and tools that have been made available based on the target population that they train. So we do have material in Haitian Creole, also in Polish, based on the target populations for the trainings. One thing I wanted to share with you is our WTP briefs. This is a new tool that we've started to pull out. And the latest one that we currently have out now is a building an occupational infection prevention and control plan. That document is very essential in making sure that you look at all the elements on how to protect your workers. And I'm going to be very, very clear about this. The only way for us to be able to stop COVID-19 from continuing to infect us is to use all the tools that we have at our available to use. And that means the social distancing, that means the masking while you're indoors, and of course, getting your vaccine. So those are absolutely critical. And what we do in our materials that we develop is help you to build that plan and that control plan and look at your environment, look at your workplace, look at your homes about what you want to do. We've also developed several other briefs looking at selection and use of portable air cleaners to protect workers from exposure. And a lot of the air cleaners that we talked about and the resources that we have at that brief is available for commercial and residential use, but we want to make sure that you understand what is important looking at ventilation, because that's one of the things that we think we're not doing a very good job at as far as when we have individuals in larger communities and workplaces. So we wanted to make sure that also with all the resources that we have available to you is that COVID is a new disease. It's evolving, it's changing. So all of our tools and resources, we try to make them evergreen. We try to go back and update them, and we put on our website the dates that we are updating the materials and tools if they're more important. As you can see, some of them have been updated in April of 2021. And then we'll have new bullets here that show anything that's being developed. We're actually in the process right now of developing a Delta variant brief, and we're going through clearance right now through the National Institutes of Health to have that available. So we hope to have that out within the next week or so. This is the cover for the Building and Occupational Infection Prevention and Control Plan. And I think it's important that we make sure that we share this across the board, because you can utilize this in your workplace, in your home, to really look at what you want to do, because the models of infection prevention and control is so important. And the documents that we have available on this website and in this particular brief really help you to adapt and utilize the tools and materials that are out there. So what we tend to do when we develop our briefs is we look at all of the material that's developed, whether it's OSHA, NIOSH, CDC, NIH, and we put them in there focusing on workers first and then communities secondly. In reference to future directions, we're going to continue to do training delivery and responsiveness around COVID. We're going to continue to do work and a lot of the activities that we're doing under our environmental justice and climate change program. And one of these days, I hope to maybe come back and share with you what we're doing under the Justice 40 initiative for our environmental career worker training program, which is what we focus on providing training to underserved and unemployed workers across the United States. And of course, we're going to continue to do our training dealing with hazardous materials and emergency response across the United States. We're in the process of revising our wildfire training tool, because that's been essential to help with the wildfires on the West Coast. And we provided additional training resources for those grantees to offer more training to other folks who are going to be responding for wildfires. So thank you for listening, and I'll be more than willing to answer questions later on. Thank you so much.
Awesome. Thank you so much for that, Mrs. Beard. I am definitely extending an invite to you to come back and to share the work that you're doing in regards to the environmental aspects related to COVID.
Yes.
Yes, indeed. Yes, indeed. Thank you so much.
Mm-hmm.
And next up, the next presenter we have is Mr. Rodney Jenkins. He serves as the Health Director with the Durham County Department of Public Health.
Good evening, everyone, and thank you so much for having me. As I said to Kirsten, I was double dipping this evening. I did have a Board of Health meeting, but luckily for me, we were able to knock things out real quick, and I'm here. So I will do my best to share my screen, but before I do, I just want to say thank you to the Nsp chapter here in the Triangle for having me. We will do our best to give you information as to what's going on with COVID. I apologize, I'm trying to share. All right. Can you see my screen?
Mm-hmm. We can see you.
Okay. All right. Well, as you can imagine, we here locally in Durham have been at this for quite some time. You know, we've been very fortunate to be able to have the support of local elected officials, to include Mayor Schul, to include also Chair Brenda Howerton. My slides are going crazy. I apologize. So I'll start my intro because I will say I loved your theme. The Miseducation of Laurel Hill is one of my favorites. So you'll see a little bit of a couple of Easter eggs in here every so often. But I'll start my intro, which I always do. I always want to let people know currently what we're doing and how we're doing. So right now, the past 7 days, our cases have been right at 397. Unfortunately, we have had 265 deaths due to COVID. Our hearts, minds, meditations, and prayers are always with those families who have lost loved ones due to COVID-19. Other deaths remotely attributed to COVID is right at about 11. Our 7-day moving average of positive cases is 56 positive cases. This is a decrease. So right now, as Dr. Thompson has eloquently put it first off, you know, we're starting to see the beginnings of that 2-month lull, because throughout the pandemic, we've had like a 2-month surge, and now it seems as if we're starting our 2-month lull where, you know, cases are dropping and everything. So we'll take it. And we're certainly hoping with all the vaccinations and everything that's on the horizon, that'll be a much longer than 2 months. So far, since October 13th, there have been 733 cases. The X factor in our opportunities to serve the community has been our data. We have been fortunate to be able to really highlight COVID-19's impact on the community through a racial equity lens. And we provide disaggregated data by race and ethnicity to really make sure that we gain an understanding of the trends, to give an accurate picture of how COVID-19 is impacting communities, you know, really apply resources to address those needs. And we want to make sure that our officials are able to really have this information that's easily accessible. We provide weekly reflections, which provide a deeper dive into COVID-19. And of course, our infographics are done in English and in Spanish, and we make sure that we put that on our coronavirus data hub. We also develop vaccine distribution dashboards just to make sure people know about vaccines, can get accurate evidence-based information to help them make informed decisions. And then, of course, we created vaccinations by populations of color because we certainly wanted people to know what was going on with their particular demographic. We also meet with community partners such as yourself to review data and develop strategies. And we also just want to make sure that we can improve access to populations of colors and those who are most impacted. As you would imagine, it's been a long road for me. I came into the position January of 2020, and I have had to present at every Board of County Commissioner meeting since then. So again, it's important for our elected officials to always know what's going on. Can't take my eyes off of you. This is our crown jewel of our response, which is our coronavirus data hub. We created this data hub to help track case counts by demographics, positive testing rates, zip code, map, resources, and more. We want people to be able to have access to the information. From a statistical perspective, we had to wait until our denominator was greater than 500 because we didn't want the chance of people being able to be identified. But of course, as you would imagine, since then, it's been, you know, really, really robust. But this is the information that we wanted our communities to have. And I like to say that this is an award-winning data hub. The National Association of Counties did recognize Durham Public Health for our efforts, particularly around our vaccine data hub, to let the public know what's going on. So big shout out to our data management team here at Durham County Department of Public Health. So we tell them through our communication and outreach activities, what's going on. So we maintain this website, COVID website. It's also in Spanish. We do a whole lot on social media because we do realize that people want information at their fingertips whenever they want it. We do a lot of graphics and info documentation. We've distributed more than 30,000 printed information documents. We do realize that there's still that segment of the population that likes things in their hands. So we've done a lot of door-to-door campaigning through our Bull City United and Project Bill teams. We've also handed out materials in free meal bags to DPS schools. set up tables outside of grocery stores, and we did a whole lot more. Public health does not operate in a vacuum. We have many, many partners. Among them includes Durham Public Schools, the Community Health Coalition, Durham Tri, El Centro Hispano, Cure Americas, just about all local pharmacies. We've done a whole lot of collaboration, and I'm most proud of the fact that COVID-19 has really helped us do a lot. And then, of course, we're going to tell them a little bit more. We have done more than 50 outreaches since December 22nd of 2020. Those outreaches are not easy. It encompasses us throwing up tents, making sure that vaccines can stay ultra cold, making sure that we have the personnel to greet people with paperwork, to be able to do the vaccination, and also to be able to observe them after they've been vaccinated. We've pretty much done it through all seasons. And in the month of September, last month, we decided to take a little break because we've been at it since December 22nd. But we know that we're going to get back at it. We had a very nice campaign when masking was important, back when the only public health prevention strategies we had were the 3 W's. And that video featured prominent community members and Durham employees. So we did that back in August of 2020. Everyone always says, ladies and gentlemen, they heard me on the radio, but I've never heard me on the radio. I've done a lot of radio campaigns with Radio 1 and all the major radio stations, from R&B to hip hop to a little bit of everything, talk radio. We've also partnered with Lale radio station to do Spanish interviews, and I promise you, I do not speak Spanish. So I'm thankful for my interpreter, Miss Anna, who's been able to take care of things. As far as English only, we've had media roundtables. As mentioned earlier by my distinguished panelists, vaccination hesitancy was real. A lot of information and misinformation was out there. So we wanted to make sure that we partner with everyone to dispel those rumors. We've had live TV show interviews with Marielle Beasley and a couple others on ABC 11 to discuss COVID-19 progress, particularly with the Back on the Bold campaign here in Durham. We've done live presentations. I remember it oh so well. It was a long time since we all were in church, but in February, I was at Orange Grove Missionary Baptist Church live. They wanted me to come there and stand in the pulpit and tell their parishioners about COVID-19 vaccines. So it was a pleasure to do it. And I wanted to make sure I highlighted the panel for Up Next Educational Series by Blue Star Carolinas. That was actually in Wayne County. They asked Durham County to come to Wayne County to tell about what we were doing in Durham because they heard so many good things. So we were happy to oblige back in March. But again, we're here with the National Society of Black Engineers, delighted to be here. And the things that we've done, of course, not to leave out our Spanish-speaking population. We've done informational videos by our foreign language interpreters here in Durham, Public Health. We've done lots of articles in Spanish, particularly through the publication Revista Latina Nsp. We've done Facebook Live events. Again, special thanks to Ana Bonilla, who's been my interpreter all along. We've done interviews with Pilar Roca Goldberg, who runs El Centro Hispano. And we've done some campaigns on Univision through CARES Act funding. I leave you with this: everything is everything, or I should say everything was everything. Nsp is personally near and dear to my heart. I was a part of the collegiate chapter of Nsp at the Citadel. You see us really enjoying things, enjoying ourselves at a Nsp conference that was at Hampton University. Being Black students on predominantly white campuses, we knew that Nsp was a fine organization. I served as our chapter secretary. And we knew it was a way for us to get out of jail, if you will, but also to learn the fundamentals that Nsp had to speak on. And I consider it a joy and definitely a privilege to have been a part of Nsp. I know we'll have some questions at the end, but I thank you so much for your ears, and I appreciate all your support for us in Durham County.
Outstanding. Thank you so much for that presentation. And I did catch your little nuggets and your tributes to Lauryn Hill. So I did catch 3 of the songs. Yes.
I made sure I put 3 of my favorites.
Yes, indeed. Yes, indeed. And thank you for sharing your historical presence and activity with Nsp over the years, and that you come by way of Hampton. As I've shared with a couple of the others on the line, I actually got started in Nsp back when I was an undergraduate at Penn State University. And, you know, once a Nsp member, always a Nsp member. It's always in your heart. So thank you for sharing that. And actually, this is a great time for us to go into the question and answer session with the experts. Before we get started, I wanted to ask our program chair, Ayanna Ferguson, if she had any questions or comments she would like to share.
Thank you, Kirsten. I don't have any questions off just the top of my head right now. This has been such an informative event. I really love the ties back to the Lauryn Hill song. I was jamming as I was thinking about some of those. But I really appreciate everyone joining tonight. I think there is, as usual, there is a lot of demystifying needed in our communities. And ultimately what ends up happening is we end up getting access to things like vaccines and other healthcare options, but we don't have the education. And so it's nice to be able to have and host an event like this for people to have a user-friendly opportunity to hear from the experts. So appreciate everyone joining this evening. Really appreciate you, Kirsten, for hosting this evening. And yeah, that's all for me.
Awesome. Thank you, Ayanna. I'd be remiss if I did not share, as you made that statement, it reminded me on that Sunday when the theme kind of like was going through my mind. And here it is Sunday morning and we're going back and forth and texting the theme, you know, and at the end of the day, it's about letting your just chatting. I mean, there's a lot of information coming at us and you don't always know what's right, what's not right. And sometimes people say it like they mean it, like it's really right, you know? So just thank you all for dropping that knowledge and sharing what the truth is in regards to COVID-19. I know I have 2 questions on my mind that I've been thinking about, in particular for you, Rod, in regards to the variants. How many variants do we currently have in Durham County?
To my knowledge, only 1. And I know, I'm saying to my knowledge, that's because the state has not contacted me directly. Whenever there's a presence of a new variant, which Dr. Marion Johnson-Thompson has eloquently listed all of them, I was like, wow, I forgot a couple. But whenever there's a new variant that enters our county that's detected, they call me to let me know. And for those of you here in Durham, you may remember we did do a press release when the Delta variant made its way. That's to notify the public, you know, again, part of my duties to let them know in order for them to keep themselves safe. But to my knowledge, Delta is still the predominant variant of concern. And at present, it's still, I say probably upwards of 98 to 99% of all infections is the Delta variant.
Awesome. And Victor, I see you turned your screen on. Can you touch bases on that in regards to the variants here in North Carolina?
Yeah, I would echo what Roger said. The predominant strain that's impacting us now is the Delta variant, and I don't know the exact number, but I do know that over 90% of the cases that we're seeing are the Delta variant. And I know we heard about I think it's the Wu variant, but I do not believe we've had any cases to show up in North Carolina. It's been the Delta variant here.
Awesome. Thank you. Another question that I was wondering in regards to the Delta variant, and we're hearing so much about the Delta variant, is geared towards you, Mrs. Beard. In regards to the variant, how is it different in regards to how easy and hardy it is to transmit in different settings versus the virus without the variation.
Yeah. Well, this Delta variant is highly contagious. And so what we're encouraging everyone, if you're in an environment where you don't know a person's vaccination status or you don't know too much about them, we encourage you to wear your mask indoors. And other than, getting the vaccine, wearing your mask, and social distancing, that's what we have to protect ourselves. And it's so important that we also think about the other step that I think we don't do enough of is get tested on a regular basis. I encourage everybody to get tested at least once a week if you're interacting with the public, or if you're out doing anything, if you've gone on vacation, you've gotten on a flight, you have to now actually, do that. But getting tested is also the only way you're going to know if you have the Delta variant, because some people don't have any symptoms, they're asymptomatic. So it's so important for you to make sure that you continue to get tested. And there are locations all over. Most of the testing is free as far as I know. And so we encourage you to go through, especially the drive-through testing. That's probably the quickest way for you to get your test, but that's the way to protect yourself. But the Delta variant is so highly contagious. If it is someone has been infected and they don't know it, and they're in your breathing zone, you will probably get infected yourself, even though you might not get sick. So that's what we're encouraging people to do. And from an occupational exposure assessment standpoint, if you're working and you're close to someone, you absolutely need to have your mask on. It's just no way to avoid that. And that's what we encourage people to do. Until we get people up to the 80% vaccination, I would not be around anybody on a regular basis, except for people in my household, unless I have a mask on to protect myself.
Thank you so much for that.
Mm-hmm.
That reminds me of the graphic that you had shared with me over the summer, and where someone had a family gathering and how it showed how quick the virus can spread, as well as how impactful it could be if someone has an underlying health condition and they may not even know at that moment that they have that underlying health condition.
Right. And someone just asked a question, when people return from gatherings, should they get tested? Funerals, weddings, out? Absolutely. You should get tested. Like I said, I just came back from Columbia, South Carolina. And when I arrived back on Monday, Tuesday, the next morning, I went and got my COVID test. So you just want to make sure that you're protected and you're protecting your family, because you just don't know if you have it unless if you're unvaccinated. You'll know, because you'll probably get sick and have to go to the hospital. So we don't want that to happen. So it's important for us to keep these control measures in place.
And Rod, I saw you just put a note in the chat. About the 70% vaccination rate.
I apologize. I had a little trouble hearing you. Yeah, I just wanted the listening audience to know that Durham continues to be busy. We are right at about 70.3% of our eligible population vaccinated. And that's no easy feat. That came as a result of hot days in the summer at outreach events, and just continue to keep our foot on the gas. And personally, my goal is 80% for Durham, as Ms. Sharon has just indicated, because we know that there's a segment of the population that's just not going to get vaccinated.
So true. And speaking about the vaccination aspects, Dr. Johnson-Thompson, can you discuss a little bit in regards to the booster vaccination, and
Sure.
When should someone get the booster?
Sure. The booster is very important, of course, and I think it's 6 months after you get your initial, your second dose, you should get the booster. But I want to say something else about the booster and the myths associated with them. You have the myth, people are saying, well, now that you have to get a booster, I've done, why is a booster necessary? And we forget that in our healthcare system, there's so much that we're doing with COVID that we've previously done with other infections. So for example, we have to have a booster every 10 years for pertussis, tetanus, and what's the other? Diphtheria. And we do that. If we go out of the country, you have to get it. Nobody questions why you have to get a booster. These infectious agents are so variable, right? With the measles vaccine, there's no problem, right? You don't hear about a second dose. You don't hear about a booster. With chickenpox, you don't hear about the need for a booster, but you do hear about a sequelae infection in later years, herpes zoster, right? So all of these infectious agents have, unique properties. And we just, if there's just some way that we could get people to look at the science and understand the science, it would be very, very helpful.
That's a great point. But, sometimes science seems intimidating, to those of us that don't love all things science. You're seeing all these different things with statistics thrown out. Sometimes you hear it called COVID-19. Sometimes you're hearing something about SARS. And it's like, wait a minute, what are all these different things coming at me? And I see, Mrs. Beard, you have your hand raised.
Sure, I just wanted to make another statement in reference to what Marion just said. And I think it's something that we have a problem when we can't visualize what's happening. We can't see SARS-CoV-2 in the environment. We can't see the impacts on someone unless they're sick or they're coughing. But the problem is that it's there. And we know that it's there because people get infected every day. We brought and have shared the stats and the information. But what we have to do is we have to focus on making sure that we are explaining to anybody that we know that those control measures and what needs to be done. And we just need to have frank and honest conversations about this to all folks. I was just at a homeowners association meeting the other night that we had in our community, and we were talking about it. And they was like, well, we shouldn't be talking about that. It's people's choice. I said, no, I'm gonna talk about it until I'm blue in the face because I want people to be protected. And I share with them the locations where vaccines are within the next vaccination clinics within the next 5 miles from my community. And that's what we have to continue to do, is to share credible information and make sure that they're not and answer any questions that we have to people. And that's the only way that we're going to continue to make improvements and get those people who are on the cusp. Because once people found out that I have some knowledge on this area, I've been stopped walking through the community, people asking me questions about things. And that's what's so important to do, is to answer their questions. And if I don't know the answer, I tell them, I'll go find out, and I'll be glad to share it with them. So this is something that we're going to have to do in order to get us to that next phase. It's going to have to be personal responsibility for us once we get the knowledge to share it with others. Thank you.
Thank you. Thank you. And Victor, I see your hand is raised.
Yeah, I just want to make a point and really to kind of piggyback on something that Ms. Beard just said. We talk about how people don't want to talk about it because it's a matter of choice. Everyone should have the choice of whether they want to get the vaccine or not. And you do have a choice about whether you allow somebody to put a shot in your arm or not. But I think that the thing that people also have to understand, this is a public health issue. Because when you are unvaccinated, you also put me at risk. You put my children at risk. I know we have a lot of conversation. We see a lot of conversation about, whether kids should wear masks in school or not. And some people feel like it infringes upon, their kids' right or their ability to learn. But I think the thing that we have to keep in mind is that you put other people's children at risk when you don't want your child to wear a mask. And so while I respect anyone's right to make a decision about what happens with your body, you don't have a right to put my body at risk. And we went through these same kind of gestations when we started to ban smoking in public. And people felt like it was infringing upon their personal right, but they were negating the fact that their personal right to smoke in public was impacting my health. And so I think we have to keep those kind of things in mind. The other thing I would say is that I do think we have to acknowledge that, at least initially, part of the pushback from the Black community was about some of the historical wrong that has been done to the Black community by the medical community. And that was a very real thing. And even at the Department of Health and Human Services, we spent a lot of time talking about how to deal with that and how to acknowledge that, yes, it happened. And people are not just going to automatically trust. But, the thing I tell people all the time is that, it ain't just Black people getting the shot. Now, there are, even a lot of the people who politicized this and, tried to make light of the coronavirus in the beginning. They were some of the first people to go and get the vaccine when the vaccine became available. So I do understand that people have had their issues with the way that things have happened historically. But I, just like other folks on this panel have said, we have to trust the science, and the science says this is our best way to get beyond this pandemic is getting vaccinated.
So true. And I see your hand up, Dr. Johnson-Thompson.
Yes, so Mr. Armstrong gave one example. Actually, he gave the example that I wanted to give. And then I thought of another one very quickly, and that's seatbelts. It was actually, it's very interesting. I think one of the issues with COVID vaccinations is that we have not until very recently developed penalties, okay? So for the seatbelt, you were fined, right? And the one that you said, Mr. Armstrong, what was that again? It just slipped my mind, but you gave the example of smoking, right? So you were penalized, you had to leave, right? Plus you were penalized by those around you. And I think one of the biggest things that happened with cigarette smoking was that the children at school learned about its harmful effects, and they went home and told their parents that they couldn't smoke. So there were penalties. And until you've seen issues like Duke a couple of weeks ago that started saying you either get the vaccine or you don't, people continue because people have this idea about their rights. The other thing that I have to admit, that in addition to being so much information out there, as Kirsten mentioned, sometimes there's conflicting information. And it's not truly conflicting, because what happens in science is that whenever a scientist finds something new and it can be repeated, they want to get it out. But that's why you will listen to scientists when they speak about results. They say it suggests that, all right? It's not that it's absolute, but it suggests that. And that's because they're being very careful. Now, we've always done that, but we haven't done it such that a community hears everything. When we did it among ourselves, people knew to be leery about some items, realizing that it wasn't definite, but that it's a continuing learning process. And especially with something new like this virus. I mean, there's so much we still don't know. I mean, how long already we see that we need a booster after the second vaccine? How long will the booster be effective? But the most important thing that we need to really do is to cut down on the infection, because I don't care how many vaccines you produce, if the virus is continuing to replicate and continuing to mutate, we'll always have a problem. So the idea is to get vaccinated, to practice safety precautions so that this virus cannot have a place to replicate. Once it doesn't see a cell that it can attack, it becomes extinct. But I'm thinking, and it's most of the scientists are thinking now, that this virus will probably become endemic. And, you know, well, that's it for right now.
Yes, and I'm just sitting here saying, preach, preach. It just feels so good to be in the midst of public health professionals who know what they're talking about. You know, I mean, I couldn't agree more with all of you, particularly with the mandates. You know, again, you got to put some teeth behind what you're saying. And from Duke, even from Durham Public Health, Friday was our deadline. And we went from 36 people like, I don't know, to 1.
Okay.
You start affecting people's livelihood and their paychecks. They start singing a different tune. And also, I would also say and submit to you that when you put them up against, you know, the wall, if you will, they run and tell that as well. Like, hey, this is not a game. You got to get vaccinated. There's consequences. So again, I'm thankful that we were able to have some type of punitive result as a result of you know, it becoming official through the FDA. I can't wait for the others to do as well. But the one thing I will say, you know, as a veteran, you know, I'm just amazed by the veteran community. I mean, there's so many people, you know, the military community is what I'm trying to say. There's so many military folks that are opting for voluntary discharge because of this very same thing we're talking about now. Mind you, to get in the military, do you know how many air ejections you have to get? And you're in basic training or officer basic order, you don't know what's inside those things, but it's become so politicized. But nevertheless, you know, again, we have no other choice but to do what we have to do to promote vaccination, because as Dr. Johnson Thompson has indicated, it needs a host. It needs some place to go. And as long as we can stop it from going somewhere, it will disappear. But I agree, it probably will become an endemic and be like the number of other coronaviruses that are all around us. But we just have to deal with it.
Kirsten, there was a question in reference to if you do not get the booster shot within 6 months, is it still effective? Or do you have to get an initial vaccine again? No, the vaccines that are out here are still effective. What we're focused on right now is those who are at high risk, those workers in occupational settings where they're close, or those who have compromised, you know, health or other diseases. And so we want to focus on getting those folks the booster. So right now, everybody, if you've gotten your vaccination, you're protected. And when we say protected, we mean that you're unlikely to get sick and go to the hospital. You might still get it, but you will have a higher likelihood of survival from the infection. So we encourage you to go ahead, if you meet those groups, then you go ahead and get your booster shot and have that done. And I know that right now, I just saw that FDA just recommended that Moderna booster. So hopefully we'll be hearing about that soon. The NPR News just popped up on my phone a few minutes ago saying that. So we're very happy about that. And the other question about, do you have to get an initial vaccine again? No, you do not. Now, if you are an immunocompromised individual, you may have to, and you have to discuss that with your doctor. And that's the only person that can really tell you whether you would need to have that, because if they're doing treatments and the impact of either antibodies or anything in reference to if it's a cancer treatment or those type of things, you might have to get an additional dose. And so that's something that you have to discuss with your doctor. And I believe that's the latest information that I've seen and looked at on the CDC website. I don't know if Rod has any additional information, or Marion, but that's what I'm aware of in reference to both the booster and the initial vaccine.
I'll say you're spot on, Ms. Beard. You know, for the most part with the booster, you actually have to self-attest. And I tell my folks all the time, we're not detectives. I mean, we're disease detectives, some of us, but we're not detectives. We're not going to shake anybody down and say, are you really needing a booster? We're not going to do that. So, you know, she's right. The main ones that we're really focused on is those people who are not vaccinated at all. But those people who truly want to protect themselves and come in, you can self-attest that, you're 18, or, you got this, that, and the third, no problem. We'll go ahead and give you a booster.
Thank you. Dr. Johnson-Thompson, I see your hand is raised.
Oh, I never put it down. I'm sorry. No, I'll take it down. Let me see.
Yes, indeed. Yes. And now there's some questions in the chat in regards to the state fair and how one can remain safe if they go to the state fair. And kind of modifying that question a little bit, what are the guidelines for if you attend the state fair, as well as the vendors and those preparing the foods at the state fair, and how can you stay as safe as possible as you're out enjoying some North Carolina fun? Don't all raise your hand at one time.
I can,
Go ahead, Sharon.
Okay, I think it's a personal choice whether you attend largely crowded activities, because you increase your risk of exposure to SARS-CoV-2. So you have to think about what your status is. Are you one of those high-risk groups? Do you have an underlying condition? And you have to assess your own risk in reference to going in those environments, because you will have a more likelihood of running into someone who might be exposed, who might have COVID. So those are the two things that you have to think about. If you are attending these types of events, you must wear your mask. You must try as much as you possibly can to social distance from individuals if you can in those environments. But I encourage you, if you go, do not go when it's the first night. Do not go when it's crowded. If you come there and it's a lot of people, try to go on off times, because what you want to do is avoid exposure and when you go. So it's important to really think about it. And if I had a child, I would not probably want to take them to, to a crowded event because they're unvaccinated, and it just increases their risk and exposure. But if you do that, please make sure that they're masked and you continue to social distance and wash their hands and do all the things that is important. But it is a personal choice, and I can't tell someone to go or not to go, but you just have to make sure that you're protected.
I think Ms. Beard can drop the mic on that one, because that's it. There's nothing else to say. That's it. It's a personal choice, and I certainly would I co-sign on that. Go if you must go during off hours. Don't go when it's the rage. Take some time off. Go like on an off Tuesday or Wednesday or whatever, and have fun. But at the same time, I'm not going. Dude. I mean, and that's just me. That's just me. I mean, I love the fall. I love football. I love the fair. I love all the fair food. But at the same time, I'm not going to risk it.
And so I'd like to add to that, if you must go. And, a big thing about going to the fair, and I was reading all these different new items they have, and I said, oh boy, I sure would like some of that. But I'm not going to get it, right? But if you have to go and you want to purchase food, don't eat it right there. Don't walk around the grounds eating food. If you can find a secluded area, do that. If you can't, just bring it home with you.
That is an excellent point. And it's so true. And some of the things that you do not necessarily think about. One of the questions that did come up in the chat as we were talking about the amazing food. I mean, it's the only time you get to act like a calorie does not count, right? Like, where else can you hear some of the amazing and crazy things that they're frying, and other than the state fair, right? Just calories no day. But in regards to eating, is it safe to, as you mentioned, to step away to the side, take your mask off, eat, enjoy your purchases, and then put your mask back on, advisable to bring some of the goodies home to enjoy at home or in your car?
I'll just make a quick statement. If you are going and you are going to eat, make sure you eat outside first and foremost. Do not eat inside. That's your best choice, because you want to have great ventilation, and being outside in a secluded place is absolutely important for you to do. there. And if you can wait to bring it home, then bringing it home is probably the best thing for you to do, because then you won't be exposed to anyone when you take off your mask and when you're eating. And I have to say, from a personal standpoint, I have not eaten in a restaurant since March of 2020. I refuse to go inside a restaurant and eat, because I do take out or eat outside, because I don't know the ventilation status of that building. I don't know whether anyone is in there that also has it. So you really have to think about that every time you step outside your door, about what you want to do to protect yourself and your family. So you have to be just critical and think about it before you do it. And so many people forget. They might even have their masks on their hands, and they walk in and they forget to put it on. So it's something that you have to really think about every time you step out of your house, your home, and you go to a different location. Right now with the Delta variant, masking up every time you go inside is absolutely essential to keep yourself safe.
Thank you so much for that. It's so true. Are there any other questions? As well, we have a small group here on the Zoom platform. Are there any questions that you would like to ask our experts directly?
Hello.
Hi.
Hi, this is Cher. I do have a question. Do you think the vaccine will ever be mandatory in the school setting, like all the other vaccines are that we get our kids vaccinated for?
I think so. I think it's just a matter of time.
Just look at California.
Well, is there a way to find out, like, if that becomes a new rule, or like if a certain school says, hey, we want to do this? Or
I'll just say if in fact that happens, it will be publicized, widely. So you will certainly hear about it. But as it stands right now, most school districts are truly just gripping with, getting their own personnel vaccinated. That's the biggest challenge that they have right now. But trust me, once they get that under wraps, kids gonna be next.
All right, sounds good. Thank you.
I have a question. Good evening, everybody. What are your thoughts on, I guess, long-term effects of getting the vaccine? So right now, it's not like we even made a whole year before, boosters are needed. So once we've had maybe on shot number 12, what does that look like for people? And, just kind of like over the long term. I know we have this as an immediate solution, but over time, is there concern about, what those side effects, will we maybe possibly start seeing some side effects, in a few years, if this becomes something that people are going to have to do every year? Just what are your thoughts on that?
Okay, I will address that. I think once again, we have to look at the science and look at the history. We take the flu vaccine every year. I've been taking it now for 15 years. I think nothing of it. It's time to get the flu vaccine. We really don't know. I mean, there's so much we don't know. I can remember, and I'm showing my age, I can remember getting the polio vaccine. I can remember standing in line for that. And we got it. At the same time, we got it because we saw so many children who were crippled. Now, though we know people are dying, maybe the difference there is we saw crippled children, right? And that was always in our face, as opposed to when people die, they're gone. So we've lost, as the public, I mean, you don't see that. It's like somebody else. So I'm just saying that there's so much that we don't know, but we have seen over the years that vaccines work, all kinds of vaccines. The one-shot vaccine, the booster shot vaccines, the vaccines that lead to herpes zoster, long-term, maybe something like that might occur. We just don't know. And then, of course, as I mentioned, we take the flu vaccine every year, and we've seen no repercussions from that. So it's just a wait. Well, I hate to say it's a wait and see, right?
Yeah, I mean, but I you know, just kind of to your point, I think that's kind of some of the questions that some people have, and then also like interactions with other medications you have over time, or the vaccines you have. Like I've been hearing that it's okay to get the flu vaccine and you know, getting your booster at the same time. And some people don't think that's a good idea because if there's a reaction, you don't know which one it is. So just, you're right, there's still a lot of variants, I don't say variants, but variations of things that we still have to just kind of, you know, see, you know, what happens. What are your thoughts about Novavax? I know there's some new products and things out there that we don't hear as much about. Do you think that would be a vaccine that could be one that people may choose to get if they're not vaccinated? Or, you know, I hear that Moderna has a new pill out. What do you think about some of these new products?
Oh, well, I know that Merck has submitted a—
Yes, Merck. Mm-hmm.
Merck.
Antiviral.
Mm-hmm.
Yes. And I mean, you know, it's undergoing review by the FDA now, and it's supposed to inhibit the viral RNA. Okay. Very similar, I would imagine. I haven't looked into it, but you remember the drug remdesivir?
Mm-hmm.
I think we talked about that when my first talk, and that was inhibited RNA, but now they're finding out that it's not really working that well.
Okay.
So we'll have to see what the FDA says, you know, and they will be looking at the clinical trials, and we'll see what they say. But, you know, I always want to emphasize that it's so hard to find an antiviral agent as opposed to a bacterial agent. Those of us who are life scientists know that the reason why antibiotics work against bacteria is because they have a cell wall. And so that antibiotic is specific for that cell wall. When we start looking at antivirals and we start talking about, well, it's going to inhibit RNA synthesis, well, it'll inhibit the host RNA synthesis as well. Acyclovir, which is used to treat herpes, it disrupts the DNA, but to some extent it disrupts your DNA as well. However, because the virus is replicating so rapidly, the small effects that your DNA sees in that short period of time, they're not detrimental. But I just really wanted to answer that question about agents to treat a virus. Very, very difficult, very difficult.
And I'll just add, Ms. Tony, to your point about Novavax. Those people who participated in clinical trials for Novavax, it is recognized as a vaccination per the North Carolina Department of Health and Human Services. So it very well could be on the horizon, could be something that's promising, but nevertheless, you know, for whatever reason, ACIP and the FDA chose not to allow them to be the vaccines that were broadly distributed. All the points that you make just kind of brought me back to January. I mean, when I did town halls, those were all the questions. And I like the way that, she presented. You have to be very forthright. At that time, what we knew was what we did not know, because it's just so new. But at the same time, in layman's terms, I mean, I heard, my wife's from Lumberton. I heard an old country person say it best. I know that COVID can kill you. And I know for sure that if I don't get vaccinated, I could die. And the attack rate is just so strong. For those who are unvaccinated, as Mr. Armstrong's presentation said, there's a 1,500% chance that you could die. But if you're vaccinated, you got a little bit more of a defense. So I choose vaccination. But, you know, again, it's a personal decision.
Right. And the other vaccine is the AstraZeneca, the Oxford, that is approved. So that's another one. I know several people who are in those trials and they're vaccinated. So that's approved for, you know, the United States also. But one other thing that I wanted to say is that we here in the United States have a strong commitment to, you know, rights as a citizen of what they can do, what they can't do. But I want to bring up a country like Australia. They've only had 1,400 deaths from COVID-19. That is a huge country. But they actually took all of the scientists' warnings, the control measures, the social distancing, and all those to heart, and they actually did what they were supposed to do. And they don't have the variants like we have. Delta variants, I don't even know if they're actually over in Australia yet. I mean, if you know, so that's the thing. And they don't have as many people vaccinated, but they're working on it. But we just have to be clear that these control measures, until we get the number of people vaccinated and we can stop the spread of this Delta variant, we have to use all those measures that we have at our availability to utilize. And we have to really think about this from a quality of life standpoint, because we're still looking at those long haulers, those individuals who had COVID, who are still finding out they have mental capacity issues, they have other lung, they have you know, cardiovascular problems, and the research that's going on right now at NIH on those long haulers. We have no idea what type of impact is going to happen to those individuals who've had COVID. So we may have created a whole nother series of problems because we won't get vaccinated, we won't do these control measures. So we have to keep communicating with people about the necessity of getting vaccinated and staying safe so that people do not have to experience the long-term impacts of COVID-19.
Yes, that's a good point, Sharon. And it's interesting because it turns out that diversity, and we're a very diverse country, brings a lot of these issues to the forefront. If you look at homogenous societies, doesn't happen. But I wanted to also speak to the other point about the old folks. You know, I was pleasantly surprised because I had not looked at the data. I showed it to you earlier. I don't know if you remember it, but it talked about percent of the population that was fully vaccinated. If you look at the 18 years of age and older, leading up to 65, 68% of the US population is vaccinated. But if you look at the over 65 group, 84% of this population is vaccinated. Is that wisdom or what? The old folks know something, right?
Well,
anyway, I just thought that was interesting comparison.
And I wish I could turn the camera around so you guys could see my mom in the background. She's laughing. I believe in educating the whole household when I do these talks and we have discussion. And she's over here saying it's wisdom, you know?
Yes. We know something, you know. Tell your mom I'm in her group. I can observe it. Yeah.
Yes, indeed. You know, wanted to touch about, because there have been some discussions in regards to if you go to a restaurant, and sometimes you see restaurants where the employees are wearing a face cover, and then you go to some establishments and the employees are not wearing face covers. What is the general guidance in regards to wearing face covers if you're preparing foods for, you know, the general population's consumption?
They should be wearing face coverings. They should be having head coverings. I mean, those things have not, I mean, COVID, the face coverings, that's changed. But all the other environmental health, safety regulations are there. And as a patron, you have the right to call them out. I mean, those are the calls that we have. Those are the calls that we get all the time. And we investigate each and every one of them. But yeah, you know, that's a part of keeping yourself safe.
And you should also just get up and leave. I mean, why would you stay there?
Exactly. That's one of my criteria. You look at cleanliness, you look at, are they putting the controls in place, and you make a personal determination, do you want to risk it? And I'll tell you, since I've been now traveling to Virginia and South Carolina, those are the only places I've gone. And since COVID came out, I'm noticing the changes in South Carolina and Virginia. Most of the people that are not wearing masks when you go into indoor places because it's not mandated. And so therefore I'm amazed. And so I tend to make my determination. If I walk into a place and it's highly crowded, even to even go take a takeout order, I just turn around and walk out because I would choose not to be in that environment right now. So it is about personal choice in certain places that you go to. But it's amazing when you go to so many places now in other states, they are not requiring their folks to wear masks, and you just have to be safe and stay out of those environments.
To your point, Sharon, I think that is part of the confusion. I happen to be from South Carolina, so when I do go home, it is a little struggle for me to go out, and I haven't been back in a while. But when people see that the business is open, they're doing this, they think it's okay because they kind of expect that the business would drive the right behavior for the public. But that's a very good point, that people have to have their own awareness and they have to make these assessments for themselves. But if they go somewhere and they just assume that the business is doing what's right for the general public, and that's not necessarily the case. So that's a good point.
Yes.
And to your two points, to the previous point, I made sure I drop in the chat Durham's percentage over the age of 65. 99.9% have received at least one dose. That's all of them. And then 86.4 are fully vaccinated. That's wisdom. That is wisdom. Again, to my fellow South Carolinian, I'm from Charleston. You know, I just shake my head when I go home. I mean, I'll be home in a couple of weeks. I just shake my head because, you know, we're so different from South Carolina in our leadership. The governor believes in the science. You go to South Carolina, McMaster's could care less. I mean, it's just so different. But I think that's the advantage that we have and the privilege that we have. We can see the dichotomy and just pick it apart.
Yeah, and especially the school system there too. Like they don't have to wear a mask. And I did have a friend that recently passed. She got it from a daughter and so forth. And so just public practices do not drive the right behavior, do not enable a safe environment for people, unfortunately. Mm-hmm. I think somebody has a hand up. I think Jonathan Winstead has his hand up. Mm-hmm.
Yes, this is Jonathan Winstead. This is to the panel at large. What requirements are right now for reporting of clusters, either at schools or businesses, and what controls are in place to monitor that reporting?
I apologize. I didn't hear the first part of the question.
Yeah, so the first part of the question was, what is the requirement currently for the reporting of clusters, COVID-19 clusters? And then my second part was, what controls are in place to monitor?
Clusters, that's what you were talking about. 5 or more cases, confirmed cases represent a cluster. As it stands right now, we're in I just reported to the Board of County Commissioners on Monday that clusters are starting to dissipate as well. Control measures, of course, with the schools, we're just telling them, like, if you know there's a classroom that has a cluster, you're able to like just really, quarantine that classroom, kind of make them go. The good thing is that we've not had to shut down a school. And I'm just going to knock on wood because of the fact that we do have public health nurses that work, school health nurses that are public health employees that are interconnected with our surveillance unit. Every Monday at 2:00, we have a standing meeting with Durham Public Schools to really go over everything. we talk daily, so the schools have their own surveillance team that they're kind of beefing up. I think they've hired about 5 or 6 people to take care of that. And then of course, we've been at this since January 2020. So together, we kind of work things out to make sure that we can keep the children safe first and foremost, but most importantly, keep the environment clean. Some schools are better than other. Mr. Winstead, I'm gonna be very honest with you. Some schools are better than others. There's been a lot of educating that we had to do with the principals because some of them are just running. I mean, they became epidemiologists, and you might have young ladies that may have like some personal issues, and then all of a sudden they're equating that to COVID. No, you can't. It's defined. The NC Power Schools toolkit is our guide, and that's been backed by the CDC. So we've been preaching that all along. Don't veer from it. It doesn't matter if you're charter school, parochial school, or public school. That is the standard. So, I mean, those are the things that we've been doing to try to keep clusters at bay and try to keep the infections down. And so far, so good. I mean, if I could give us a grade, I'd probably say right about B-. I mean, we still have a lot of work.
Great point. And speaking along the lines of schools and perhaps utilizing some of the communication directly to the parents, I say this tongue in cheek. While I am in Wake County, we receive newsletters every week from the principal. Is there an opportunity in those weekly news blasts that come through that you get through text messages and emails to share information in regards to COVID-19, as well as if they have any questions to refer them back to the health department so they can speak with a contact tracer or community health worker team to address their questions?
Absolutely. We welcome it. I maintain a great relationship with Dr. Pascal Mabenga, Chip Sutterick, who's the PIO, and we're constantly trying to let them know, like, hey, we're here. There's things that's going to help people to remain safe. But I think it's more or less it's a situation in which this is new to everybody. Particularly with schools, they're taking it sometimes literally an hour by the hour. So we do our best to acknowledge that, but we are on the phone all day long with Durham Public Schools, all day, just to make sure that everybody's safe, just to make sure that we can keep clusters at bay. That is our charge right now.
That is awesome. Thank you. And then, are there any other questions from the audience?
I think Tony had made a comment about a location where they're not wearing masks. And if you were talking about the same place that's in Wake County has a mask mandate for anyone indoors. So absolutely report them. And so I'm putting in here, I think that it was established in August 20th for Wake County as far as that mandate, and it's still in effect.
Awesome. Thank you for sharing that. And we'll make sure that we also share that information out across all of the chapter members that were not able to attend, as well as our affiliate chapters as well in the area. One of the other last questions that was on the mind, and again, thank you all for your time and your expertise. The time has gone by so fast because it seemed like such an amazing conversation. Did not even realize how fast the time has gone. So again, thank you all for dropping the knowledge and saying it in lay-friendly terms so we're all able to digest all of the information. One of the last questions that we were wondering is in regards to going to your doctor appointments. Some people we do know from like the American Cancer Society, people are not going and receiving their routine cancer screenings. What are your takes and your feelers in regards to, individuals as they go out to receive their routine cancer screenings that are needed, as well as precautions they could take in ways that they could feel more comfortable and safe as they go out into the community?
I wanted to say I think it's absolutely necessary for you to go to your screenings and your appointments and be safe while doing so. Wear your mask. and make sure you're using proper hand hygiene and those type of things. It's absolutely critical, because what we don't want to see is individuals having lapse and, don't get the mammogram and find out, a year later that they if they would have got that mammogram, they could have had the diagnosis of early breast cancer. So it's important that they do it, but you have to be safe. And this is one of the things that I'm encouraging people. Right now, there is an abundant supply of N95s, KN95s. We're encouraging people to double mask if you're going into hospitals. But it's important, if you go into those types of facilities, that you use extra precautions, because of the fact that it's important that you do so. And we have some materials on our webpage that talk about, if you're going to wear a mask, double mask, how to wear it. But those KN95s, you can get them now for they're very inexpensive. And I encourage you, if you're in those type of settings, to wear that type of mask and protection. Now, I personally, and I have to say this from my personal vantage point, going to see a dentist is something that I have to think twice about, because those environments, you have to take off your mask. So if you're unvaccinated and going to the dentist, then the chances of exposure is very high for anybody else who comes into that room after you have left there. So this is my criteria. Then when I go see the dentist, I go on Monday mornings at 8 o'clock. Nobody's been there before. Everybody in the doctor's office has been masked. If they were there before on Friday, it's dissipated, ventilation has been good, and so you're safe. But you have to think about these type of things for your own personal responsibilities, because you still want to get your test, you still want to get your teeth cleaned, but you have to think about that very carefully in reference to your status and being compromised. So that's something that you really have to think about. But absolutely, other screenings, those type of things, please get those done, because this is what the healthcare system is there for. And we want to make sure that we're able to provide those services to people who need them.
Thank you.
I can't say anything differently. I must say it took me a while to go back to the dentist. I did go a few months ago, but I was pleased, and actually I called ahead of time, that there was an air filtration unit that was being used. And once I found that out, I felt very good. And these air filtration units are really great. My daughter-in-law, with our new grandchild, when we would go, she didn't do it the last time, but she would always have that air filtration unit on, in addition to making sure that we got tested before we arrived. So, you can't be too careful. It's best to be careful than to, let your guards down.
Indeed, better safe than sorry. And
That's
you see downstairs on the second floor, we do have our dental operatory, and that hands down is probably one of the cleanest and most sanitary places we have. As you mentioned, we purchased like huge air purifiers for our dental. That was one of the first places that first areas that we placed the air purifiers in. And of course, they're all masked up, full battle rattle, extra cleaning. We do all of that stuff. So, I mean, I can say with certainty that's a very sanitary area.
That is reassuring to know and to hear. Especially you don't have a mask on, your mouth is open. I think I received my vaccinations back in March, and when I said, okay, I can go to the dentist now, and they gave me an appointment in November, and I was like, wow, it just and looking at that time frame, because to your point, you do feel a little bit more comfortable, at least I did, going to the dentist vaccinated versus not being vaccinated. This has been such an amazing time. We have a couple of more questions that have come through in the chat, but I want to be mindful of the speaker's time. If you guys have a few moments to answer a couple additional questions, or we can also get a list of some of the questions from everyone and then email them out to the presenters to get responses. and then share them out with everybody.
It works. I can be brief about the air purifiers in your home. It's a personal decision whether you use the air purifiers. And for people who have conditions, asthma, those type of things, I would certainly suggest you invest in having one of those because it helps to clean the air. But the most important thing is to increase ventilation in the home. We don't do a good job of opening up windows and letting fresh air into our homes, and we need to do that on a regular basis. And especially now, since the temperature has cooled, opening up your windows, having fresh air, it increases your exchange rate in your home. And that's the most important thing to do. And that's what air purifiers do. That increases your exchange rate, and it also cleans the air that you currently have. But you can clean it by increasing the air that comes in from the outside. So the thing is that there are brands that are expensive and brands that are inexpensive. So what you have to do is look at your facility, your home, to determine the square footage and the use of the different types of air purifiers. I posted in the chat box our brief on a selection of use of portable air cleaners to protect workers, and that's the same thing for homes. You can utilize that. And in that particular brief, we have resources about the EPA and what they also to say about air purifiers. So please just take a look at that and it'll give you some information.
Thank you for that.
As far as the holidays are concerned, I would just say, of course, we want everyone to be safe, of course. Consider getting the test before you go. Get tested before you go, so you definitely know what your status is. I mean, even if you're vaccinated, because we know what the Delta is doing. If you are going to participate in gatherings of large people, I mean, there's nothing wrong with going outside, doing a little bit of, something outside, or making sure that where you're going to congregate is well ventilated. Don't be afraid to step on toes. I mean, if your family, you got family members that are not vaccinated, you gotta call them out. Because the last thing you want is for your event to become a super spreader event, and there's still that potential. And then of course, when you come back, get tested again. But I just say, if you can keep it small, do that. To Ms. Beard's point, if you're going to be inside an area, just make sure it's well ventilated, up those windows, and enjoy yourself. But I know everybody. There's no getting around. The holidays last year was horrible for us, public health for us, because even though there was no vaccine on the horizon, people still did whatever they wanted to do. And we are cautiously optimistic that with all this immunity that we have going on right now, that maybe, just maybe, we'll come out this one a little bit unscathed.
Kirsten, may I say something? I meant to say it back and I forgot. And that's the issue about the distrust in the Black community. And I just want to make some clarifications. You hear about what they did to Henrietta Lacks, and they did nothing to Henrietta Lacks that everybody experienced. Back during the time of Henrietta Lacks and up until 1972, there was no such thing as consent for anyone. And the mistake they made with Henrietta Lacks is that her initials were used on the container. And because usually they would give 14, some number. And so that was the way it was eventually linked. The other thing is that, yes, Tuskegee was terrible, but all across the United States, they did experiments on many vulnerable populations, from prisoners to Jewish babies who they actually fed hepatitis virus to see how it would progress. Disabled people, and a host of psychological tests. Some of you might have seen the movie about the the triplets, I don't know how they were, these were white guys, but triplets who were separated, and they did all kinds of tests on them to see how they responded to their environment. But eventually the boys found each other, and then, but it didn't turn out good because they were already so psychologically messed up because of what happened. But I just want to say that, to say, not that we shouldn't be concerned about the atrocities that happened 50 years ago with the Tuskegee study, but we weren't the only ones, and we shouldn't allow that to prevent us from choosing wise and meaningful preventive methods. So, you know, if you have the opportunity to share some of that, especially about Henrietta Lacks, because I just get so annoyed when people start talking about all the money they owe the family and how they did her so wrong. There was no such thing as consent. And finally, I will tell you, if you have any samples in a hospital, especially blood samples, those samples are used in research as de-identified materials, and they can pass the IRB. I was IRB chair for 15 years at NIEHS, and so I know that. But anyway, those are just some information for you to have and perhaps share when it's appropriate.
IRB's Institutional Review Boards. That's what it stands for.
Right, thank you, Sharon. And these are boards that must approve all human research studies. And the reason why is to ensure that people are fully informed about the risk and benefit. And most of the time, there's no benefit, right? No benefit to you, but to people afterwards.
Mhm.
So.
This has been such an amazing, impactful presentation and session. And the question that I have to challenge those of us, to the panelists, as well as those that are attending here on the Zoom call, as well as the viewers, are what are some ways that we can tangibly make this better? What are some ways that we can tangibly move the needle forward so that we are not as impacted by the pandemic? We know that we're going to be impacted by the pandemic, but for us to really sit back and think of ways that we can tangibly make it better for ourselves as well as our family and friends and our community at large. And thank you again so much for our panelists, for all the work that you're doing in your field and the ways that you are moving the needle forward. I just want to give you all a big thank you and a round of applause for all that you do. Thank you so much. And thank you to the Executive Board of Nsp RTP Chapter for allowing us to utilize this time and space to have this critical conversation, as well as for us to be able to share this discussion with other of our colleagues that may be in North Carolina, as well in our region and across the US. So thank you again. Elliot, do you have any final words you would like to share?
Yes, I wanted to echo your thanks to the panel. I really learned a lot, as I have in the past sessions as well. But it's kind of interesting to see how things have progressed from when we first had the program to now, as we're trying to exit a pandemic, but having, as we were talking about tonight, different aspects that are still continuing on. And so it's valuable, priceless is the word I'm looking for, thinking about that commercial, priceless, like completely valuable information that you just can't thank you enough for. And so I really appreciate you all for coming out tonight and for speaking to us. And I hope, well, in a good context, to have you all back again, so that we can learn more, and hopefully we would be on a continued and sustained path forward. And so thank you for coming out tonight. And I did want to mention thanks to Mr. Jenkins, Rod Jenkins, for the Nsp shout out. I was glad to see you were Nsp.
Absolutely.
So thank you. So, and thanks Kirsten, and thanks Ayana for leading this program this month. So everyone have a good night.
Good night.
Y'all take care. Stay safe.
Same to you.
Good night.
Good
Good
night.
night.
Good night.
And I'll share the information about Breast Cancer Awareness Month to others. I put the information in the chat, but if we can share that information on the Facebook Live thread and others, that would be awesome. Dr. Marianne Johnson-Thompson, I can't wait to meet you. Oh, she's off now. I'm gonna have to follow up with her with a phone call. I've only had the opportunity to meet her virtually because we've been in the pandemic. And so it's gonna be a true pleasure to meet her face to face.
Great job. I got to head over to a Nsp advisor meeting, but this was really good.
Thanks, Tony.
Yes, great job, Kirsten. Thank you.
Thank you guys for creating a space for us to be able to have these conversations.
I think we're still streaming. Are we still streaming?
I think so.
Yeah, we're still on. Well, good night.
All right. Good night.
And good job, Kirsten.
Excellent.
Thank you. Thank you, everyone. And I'd be remiss if I didn't. I say I'm wearing pink for Breast Cancer Awareness Month. So have to wear pink.